my name's Angie. I'm chair of the thematic group, which is around social workers working in health settings, which was set up as a sort of call so we can raise the profile of social workers, because it is quite often very isolating working in health settings with very little sort of social work supervision or support. So this forum was developed as a response to the meeting request for an opportunity for people to log on. We kind of do the session in two parts. We have a theme for the first half, and then we do question and answers for the final half. And that's around people raising questions about practice, advice, any concerns, all of that sort of thing. And just to give you a little bit about my background, I've worked in mental health for a health organisation for about 15 years. I have just recently moved to the University of Hull as a lecturer. So I have a lot of experience working in health settings as a social worker. But apart from that, my background is mainly working with older people, mental health, dementia, that kind of thing. We have Jade Stacey with us today, who is going to run our first half on Jade. Jade is an implementation facilitator for NICE, working in the field team, and Jade is going to talk to us about the NICE standards and how they're developed and how they're relevant to social work, hopefully. I will let Jade do her own little introduction with her background, so I'm going to hand over to Jade, if that's okay.
Hello, thank you for having me. I'm really happy to be here today. I am going to talk to you for a little bit about NICE, what we do, and how NICE can support social work practice. Feel free to put your hands up and join in and ask questions as I go along. You know, the less formal, the better. I will just try to share some slides and then we can begin. Brilliant. So if we could just start, if you could just put into the chat box what NICE guidelines you're aware of. Have you used any before? I can't see the chat box. It'd be really helpful if Angie or Wayne could just shout out if anybody types anything.
Yep, I'm happy to. And I'll also, if anybody raises any questions, raises the hand, I'll let you know.
Thank you. Does anybody use NICE at the moment in their jobs, or are you aware of NICE for personal reasons? One of my friends the other day said that she used NICE in a GP appointment to help herself. So that was really, it doesn't have to be work related.
I guess in terms of NICE guidelines, yeah, I mean, working under NICE guidelines, like for lots of different areas within mental health. And currently I'm undertaking a baseline assessment on the new NICE guidelines in regard to advocacy.
Yes.
Yeah, so that's, I suppose, just one example.
Thank you.
I suppose if my experience of NICE was around the baseline assessments and the organisation using the baseline assessments to check that they were delivering what they were supposed to be or not. But as practitioners, we weren't sort of encouraged to look and use them individually. That's my experience. Yeah.
And I think it's really interesting. So I'm a social worker by background and worked in sort of health settings for a long time before moving over to NICE. And actually, until I joined NICE, I didn't really use NICE as much as now in hindsight I wish I had. So I think we're not as well known in social care as maybe we should be and we could be. So hopefully today we'll kind of give you a little bit of a taster and maybe encourage you to look at and how we could support your work in whichever area you're working in. So I am going to sort of give you a brief overview of what NICE is, who we are, what we do, and then talk to you about how NICE can support evidence-based practice. I will show you our website and how to use it, because actually it's not the most user-friendly website, and that will change. We're currently in the transformation process, and one of the things we're changing is our website to make it much more user-friendly. But in the interim, you still need to be able to use it, and can be tricky. And then lastly, I'll just show you how NICE can support your CPD, which is something that is always the bottom of our list, but really important to do. So the core purpose of NICE is really simple. It's to improve the health outcomes and to reduce health inequalities. And we believe that science and evidence should be at the heart of this. And this purpose hasn't changed. And NICE first came around in 1999. And for the past 20 odd years, 30 years, it's been the same. A purpose hasn't changed. And how do we do that? So we are an independent organisation. We're government funded, and we're responsible for providing evidence-based guidance on a range of health and social care topics. We produce guidance, standards and other resources which help health, public health and social care professionals develop the best possible care within the resources available. So we do that by reviewing all the available evidence on a specific topic and then publish recommendations to improve care. And these recommendations reflect safe, effective and cost-effective practice. We don't work independently. We work really closely with local and national health and social care organisations. So, for example, we work with Health Education England, NHS England, CQC, Skills for Care and ADAS. And we all kind of work together really to encourage and support a quality and safety focused approach, where commissioners and providers use NICE guidance and other NICE accredited sources to improve the outcomes for the people that we're supporting. So before I go into NICE, hopefully this is not new to you, but evidence is, why is it relevant to social work? You will all know the professional capability framework inside out, and I'm sure you all know that there's several references to the importance of social workers using evidence to make decisions. So the example on the slide is from the end of a first placement, and here it says that students should be using a range of information to inform their decision making, and then that doesn't change. For strategic social workers, the professional leadership part says that you should create opportunities and systems for current practice to inform and be informed by research and current professional knowledge and evidence. So to meet our professional capabilities, we need to be using evidence in our work. And also, November is coming around soon. It comes every year quicker than I think it's going to. And in order to renew our registration, we have to evidence how we use evidence and research in our decision making. And so by using NICE, you can evidence this. And I would recommend you all today, after you finish today, log on to the Social Work England website, do a reflective log, and this will meet some of the standards for November, and it's a tick. So what is evidence? So there's three parts. I would always say that the person's values and preferences is the most important, and that's nothing new. And so you will talk to the people that you're supporting, find out what's important to them, find out what they want and how you can support them meet the outcome that they want to meet. That's that is the core of what we do as our social work and our values and our ethics. And I think that is something, when we're working in health, we can really promote and we can really support. We then have professional expertise, and that's not just our own professional expertise, but the professional expertise of your colleagues in both the social work profession, but also in other colleagues, so from health, working with OTs, working with doctors, everyone else. And then lastly, it's best practice. What does evidence tell us will work? What does research tell us will work? And you put all those three together and we get evidence-informed practice. So today I want to talk to you about how NICE can tell you what the best practice is. And we have lots of different products, but the two that are most useful to social workers are our guidelines and our quality standards. NICE guidelines are the thing that people usually know about. It's the most well known of all our products, and that is, well, our colleague said the advocacy guideline is a guideline. We have guidelines on a whole range of topics, and they are long documents, so they can be hundreds of pages long. They're long and they're in depth, and they provide a comprehensive set of recommendations for action. They describe what is good care and what's also cost-effective care. And that's really important as we're working in a time with very, very limited resources. And so you need to be able to ensure that whatever care you're providing is making the best use of that very limited money. And so NICE helps with that. All of our recommendations have evidence behind them, and you can see what the evidence is. So if you ever needed more information, more detail, the guideline gives you all of the information. And it's aimed at a range of audiences. And so our guidelines, more and more so going into the future, they won't be a guideline for social care or a guideline for health. There'll be a guideline on a topic, and there will be recommendations that are relevant to all different professions and all different people within that specific guideline. Then moving on from our guidelines are our quality standards. And these are very different. They are much shorter, and they don't cover a whole topic, but instead they focus on a concise set of statements aimed to help improve quality. And we focus on where we know that there is poor quality across the country or an unwarranted variation in quality. And so these are there to help you in a quality improvement project. They're really, really useful. They're written as a metric, so they're written in a way to help you measure improvement, and they're short. And so I'd really recommend that you look at our quality standards alongside our guidelines. Both of them are developed in exactly the same way. We look at the evidence, we look at the economic impact, and they're developed not by NICE, not by us, but by a committee of people who are experts in that field. And they are experts by lived experience or expert by profession. And everybody has an equal say within the committee. This next slide shows you how our guidelines are developed. So this is a long process. It can take up to 2 years. And then so we will have our topics referred to us from NHS England or the Department of Health and Social Care, and also the Department of Education. So they tell us what they would like us to produce guidance on. We then do a scope. So we look at what we could cover. Is there a need? There's no point us making a guideline on something that there's all the information is already out there where we're not adding value. And so we look at what we will cover, what we won't cover, and then we develop the guideline. So NICE, we look at all the evidence, do these massive literature searches, summarise the evidence and provide those to the committees. The committees then debate them. They have really interesting discussions around the research and around their personal experience. And this is all done in public. So if you ever wanted to come and see one of our committee meetings, you can register online, and I would really recommend it. It's really interesting, and it's another really good CPD activity. But once the guideline is developed, it gets sent out for consultation. So it will get sent out to whoever's registered as a stakeholder, and they're often organisations. And so if you're working in NHS settings or local authorities, you're probably registered as a stakeholder, and if not, your organisation can do that. And then we review all the comments, make changes as needed, and eventually the guideline is published, and then that's updated regularly. So you see, it's a very in-depth process, and it's just really to highlight to you that this isn't something that's done quickly. It's not something that's done without a huge amount of thought and effort. And actually, this is how we can ensure that the guidelines are really the highest quality that they can possibly be. And I really, you can trust them. You can trust what's in NICE will work, which I think is really important. And then this is quickly just to show you who are in our committees. So this was a photo pre-COVID. Now it's all done online. But as you can see, this is a guideline for a care home. And there's a huge range of people from different professional backgrounds, different levels within their career, and people who have lived experience and carers. And everybody is equal. There's a whole team of people within NICE who are there to support the service users and the carers to make sure that their voices are heard. So why would you use NICE when there's a whole range of other guidance out there? You have, your policies from your organisation, you have social work theories, you have, organisations such as Research and Practice, Sky. There's lots and lots of ways for you to get information and to get suggestions on your practice. Why use us? And here are some suggestions. So essentially, the most important one is that we improve the health and wellbeing outcomes for our service users and carers. We know that if you followed NICE recommendations, your interventions would work, and you're improving the lives of the people you're trying to support. So that's, you know, huge. If you need any more suggestions after that, there's a whole list. So as I've said repeatedly, it makes sure that care is effective and makes efficient use of resources. Also, it improves the national consistency of a care provision, and that's really important. This is why we first were developed back in 1999. That was because of the sort of postcode lottery for NHS care at the time. But it's the same for social care. It's not okay that if you live in London, you get one level of support. There's this certain interventions available to you and support available to you, whereas if you lived in Blackpool, it's not. That's unacceptable. If we all used the same guidelines, we'd all be providing the same level of high quality care to everybody across the country. We would therefore reduce inequalities. NICE supports quality improvement projects. Look at our quality standards. They're a really, really good starting point for any QI work within your jobs. Things go wrong, unfortunately, and if you are ever having to look at incidents and look at what could have prevented them, what can you change, NICE can help you with a platform for doing that. We can demonstrate quality to managers, but more importantly to people using our services. If you ever have to be interviewed by CQC, if you can quote NICE, it's going to really help your interview. We work very closely with CQC. We've been working closely with them on their new inspection framework, and NICE is something that they respect, and it is an organisation that they will expect you to be using. And it helps you on your decision making. That helps you if you're out by yourself, lone working, seeing an individual in their house, and you need to make a decision by yourself. By knowing that decision making is based on evidence, it can help you and can help with business planning. So what guidance should you use? We have lots and lots and lots of guidance out there. We have some guidance that will be really specific to a work setting. So the one on the screen is about transition between inpatient hospital settings and community or care home settings for adults with social care needs. We have a similar guidance, but for adults with mental health needs. We also have ones that are key to specific areas of professional practice, such as our guideline on decision making and mental capacity. And there's also ones on specific knowledge. So if you're working with a person who's experiencing a disability or an illness, you're not necessarily going to know all about all the different conditions in the world. And by looking at NICE, it will give you a quick background of for example, what arthritis is, and also what care that they should be expecting. And that gives you a really good base for the work that you're going to be doing. So this slide really is a repeat of what I've been saying. So first of all, we get our evidence, and the evidence is used to develop our guidelines, and then the guidelines are used to develop the NICE quality standards, which are the priority areas for quality improvements. Each quality standard is made up of quality statements. There's usually only around 5 to 8 within each standard, so they're very short, they're very concise, they're very measurable. And they describe what good quality care looks like, so that you can see the potential value immediately to yourself. I would really, really, really recommend you look at the quality standards over the next few days or so, because they will show you what good care looks like. They can help you identify areas for audit within your service area. They can help you prioritise areas. There's always a million different things that we can do to improve practice, but we only have so many hours in the day and they're all taken up already. So this helps you prioritise where you want to put your quality improvement effort into. We've done the work for you. We've helped by identifying metrics that can be used to monitor the quality improvement activities. And you can use these to help make a case for change. This slide is just some examples of different guidance. So this is by no means all of the different guidance that we have that are relevant to social care, but I just wanted to give you some examples that we have to hopefully demonstrate that whichever area of practice you're working in, there will be a piece of NICE guidance that will be relevant to you. Most of these are relevant across several different service areas. And the link on the slide takes you straight through to all our guidelines, which I'm more than happy to circulate afterwards. here are some examples of how NICE has been used by social workers. So they're used as a source of evidence of best practice. They're used to empower what you're doing, to make you know that what you're doing is the right thing, which is so hard when you're working by yourself and having to make decisions often in very stressful circumstances, very little time. This they use it as a benchmark for our service delivery. And so I know at the start some people were talking about the baseline assessment tool. So that's a Excel spreadsheet that NICE develops of every single piece of guidance to help you look at your current service and see if you're meeting all the recommendations, and if you're not meeting a certain recommendation, it helps you go through steps to look at what changes need to be made so that you can meet the recommendation. And here is an example of how NICE was used in a safeguarding concern. So this safeguarding concern was around pressure ulcers, and which became ungradable, and the social work team were also concerned around why the pressure ulcer had deteriorated so much. So the social worker was allocated this case, and before he sort of went straight out to the care home, he first looked at what NICE has to say about pressure ulcers. So this was something that he wasn't overly familiar with, and so he looked at the NICE guidance and the NICE quick guide, which is on the pictures on the screen, to find out more about what pressure ulcers are, around the risk assessments and how they should be treated. So using the NICE guideline, he was able to form a checklist of processes a care home should have followed in terms of risk and skin assessment, developing and following a care plan, and keeping up-to-date records. He then was able to use this to benchmark the provider to see if they were working in accordance with the national standards. So in this case, NICE supported the social worker in knowing what evidence-based quality care should look like, and he was able to use the guidance to support his decision making in an area where he had a lack of clinical knowledge and expertise. And so this example actually happened in a residential home, and so there wasn't a medical professional on hand to provide any additional support, which maybe if it had been in a nursing home or hospital environment, he would have had some colleagues to call for. But I think it really shows how it can help you, especially when you're working in a health setting, make you feel confident that you know what you're talking about, and give you shared language. I think that's something that social workers working in health really need to help us be heard by our health colleagues. We need to speak in a language that they understand, and by using NICE, you can bridge that gap and help work more closely. This is the NICE website. This is the homepage of our website. It is changing, but at the moment, this is what we've got. So if you're looking for something, it's really easy if you know what you're looking for. So at the top, we have a search bar. So if you knew you were looking for the mental capacity guideline, for example, or advocacy, you can type it in the search bar and it comes up. So that's really easy. But most of the time, you won't know exactly what it is you want to look for, and you might just want to browse and see what NICE has to say on a range of topics. The easiest way to do that is by looking at this guidance section on the left-hand side of the screen. So this here, you can then click on the different tabs and off different things come up. So on this example, I've clicked on population groups, and you get a whole host of different population groups, and you can click on people with learning disabilities, for example. You can also search by settings. So if you clicked on settings, things like care home comes up, or health and social care delivery. You can get adult social care and children's social care. So if you have a little mooch around, once you get used to it, it is fairly easy, but it does take a bit of practice. But so for this example, I clicked on people with learning disabilities, and then it takes me through to the next site, which there I can link to every piece of guidance or quality standard or other published resource that we have to support people with learning disabilities. So that's probably the easiest way to browse. This slide shows you what our landing page looks like for our guidelines. All our guidelines look exactly the same on the website. So this guideline is challenging behaviour and learning disabilities. So there's a few things to highlight to you. So firstly, you can download the guidance if you want it as a PDF copy, and then you can print it off and do with it what you wish. I personally don't like doing that just because it's so long and then I can never find quickly what I want. And I think especially in practice, I never would have had the time to read a whole guideline, you know, during a working day. So it's much easier to be able to quickly find what you need. So what I would do is click on the recommendations, and here you will get the recommendations all come up and you can click on what you want. And instead of reading a whole guideline, you can quickly get to the bit that's most relevant to you. And on each section, you can click through to get more and more information. So if you want to see all the evidence behind it, you can click through. We also have the quality standards that are related. So this will show you what quality standards we have that are relevant to this guidance for you to go through. And then also to highlight, with all our guidelines that are to support people with learning disabilities, we've also developed easy read versions so that can be used to show the people you're supporting and help them understand what good quality care should be, and you can link it here. And then lastly on this page is the tools and resources section. This is really useful as it shows you a whole range of tools and resources to help put NICE guidance into practice. And this varies depending on the guideline, but for every single one we have a baseline assessment tool, which I've already mentioned. We also have research recommendations. So if you're working in academia or you have students and you're just wondering some suggestions of what research might be useful to the social care community, this might be a good place to start. And then we have different webinars and quick guides to help with implementation, and shared learning, which is case studies. There's lots of different resources to help you, and I would really recommend having a look at them. Then CPD, you will all know what CPD is, and you're here today, so you're obviously all people that want to ensure that you're developed and you want to get support and you want to progress in your careers. NICE has a wealth of resources to help CPD. So our guidance, our quality improvement tools, our implementation tools, and our resources. By being informed and up to date, using NICE will help you abide by our code of standards and help with revalidation. Use NICE, reference us in your reflect logs. We have lots of things to help you. So we have quick guides. These are short. They are usually only they're always only 4 sides of A4 long. We worked with Sky to develop these on a range of social care topics, and they were developed to give key information on topics in a simple visual way. People tell us that they use these in team meetings, supervision, and induction training. So they're really quick and easy. So for example, we have a quick guide on promoting the well-being and positive identity for a child or young person who is looked after. And this quick guide reminds practitioners to make sure that they are sensitive and empathetic in the language used in care records and the way that they describe events, bearing in mind that the people they're writing about may read these records at a later date. They are something that you will be able to look at as you're walking out of the office. They're not going to take you hours to read. And by having a look at them, you may find some things that are useful. We also have CPD development webinars and podcasts. So these ones on the screen, really short, and they just give you a bit of food for thought, which you might find useful if you're looking for activities. And then lastly, we have a YouTube page where we have lots of different videos from NICE. Some of them will be of more relevance than others, but again, have a look through, see what might be of use to you. And that is everything from me, really. So hopefully it's been a really quick overview of NICE, what we do, how we can support you to deliver safe care, good quality care, and positive service user experience. Our guidelines are there to support policies and practice. Our quality standards improve quality improvement activities. We have a range of implementation tools to help you put NICE into practice, document your use of NICE in practice. If you can document why you've made a decision, your decisions will always be valid. It's really important that you use NICE also for your CPD. And these are just some suggestions what you might want to do. You may want to use NICE in your team awareness, have a nice champion maybe. Sign up to our nice newsletter. We have a monthly newsletter that comes out once a month on health and social care, which is really useful. It keeps you up to date with what we are doing. Think about how NICE could support you in your role. And CPD, right, do one after today. And that is everything from me. The QR code on the screen will take you through to our monthly newsletter sign up page. And I am more than happy to take any questions. I will just stop sharing my screen.
Well, that was a whistle-stop tour, Jade. Thank you. No, thank you ever so much. That was really informative.